topic very close to my heart. Have your seat. Thank you. And to help us explore the issues of diaspora engagement from a national leadership perspective, it's my great pleasure to introduce our keynote speaker, Minister Agyekum. Ghana has been actively engaging its diaspora in strengthening health systems, from workforce development to specialist training and service delivery. Minister Agyekum will share reflections on how diaspora engagement countries of heritage.
Thank you so much. Thank you for that question. While Moses was talking, a quote came to my head where it's quite popular: a tree cannot make a forest. I hope we all know that. And I'm very excited to see a lot of young people here in the room and a lot of people who are from the diaspora community. So one of the most exciting things happening in global health, which I'm particularly excited about, is the growing number of young people in leadership. So there is growth in leadership for young people, most especially young people in diaspora community. And this, being a One UK ambassador as well, I've seen how young advocates here in the UK and in different parts of the world are contributing to health conversations, whether it's on global health financing, vaccine equity, pandemic preparedness, and global health policies. Young people are contributing to these conversations through research, through advocacy, through storytelling. And young diaspora youth, they bring uniqueness to this space. And how you may want that? First is that a lot of us, we understand the health realities in our own countries. And then we also understand the structural barriers in other countries like the UK. So this knowledge is very important when it comes to translating knowledge, and also when it comes to identifying solutions, global health interventions that are locally relevant, but that are also globally informed. And diaspora youth as well, the Honorable Minister was talking about how they are connectors. So young people, diaspora youth are like connectors and bridge builders. They help to connect or network institutions, civil society organizations, non-governmental organizations, policymakers, and even community groups. So I'll use myself for example. I'm a PhD student researching on antimicrobial resistance and antibiotic stewardship, and I'm using Nigeria as a case study. I work with community members to co-create interventions on antimicrobial resistance and antibiotic stewardship. While doing that, I'm also connected to institutions here in the UK, and we're able to see how they can all work together. So that's how diaspora youth work as connectors. And another important thing as well is that diaspora youth, we have the cultural competence and trust. In my research, I found that most global health interventions, they lack cultural relevance and social realities of community members that they are meant to create. So diaspora youth, with the knowledge that they have, can help bring this in terms of creating interventions that are locally relevant and that also reflect the social realities of people. So I started earlier by saying that I saw a lot of young people in the room today. Another thing that young diaspora youth bring is that we have a lot of energy and urgency. If we look around us today, you find out that a lot of young people are not waiting to be invited to the table anymore. They are literally creating the tables themselves and bringing the seats themselves. And they do this through advocacy, digital platforms. They are creating grassroots health interventions and helping to make sure that health conversations are inclusive and that they are forward-looking. So we bring a lot of that. We are forward-looking, we bring the energy, and we want to support. But while the conversation goes on, you see how a lot of young people are creating these digital innovations to help shape global health policies. Thank you so much.
Thank you. I think that's the movements or community initiatives you have seen among diaspora that are creating value both in the UK and in countries of heritage. And what do these examples tell us about how to strengthen youth involvement, engagement in health system development? You touched a little bit on it, but if you can elaborate again, that would be great.
Yeah, thank you so much. That question is very important. And I love the questions we're also getting from the audience, which is very thought-provoking. I think that there are a lot of innovative approaches that young people are bringing into global health today. And had you talk about artificial intelligence, and I also want to highlight the fact that artificial intelligence has come to stay. It wasn't there many years ago. Instead of global health interventions to shy away from it, we have to look at ways to embrace it for it to help us in tackling global health challenges. So for young people, especially youth, diaspora youth, I will say that their contribution, I will sum it up in 2 to 3 points. First is the fact that they are using digital platforms, and then there is community networks, and then there is innovative approaches. And based on my own personal experience, I will sum it up again to research innovations and digital advocacy and digital campaigns. So I initially mentioned earlier about my research, which is PhD on antimicrobial resistance and antibiotic stewardship. So the research approach we are taking is we're not seeing the public as passive participants that you can just ask them questions and they tick the box and yes or no. But we are looking at ways of how to better engage the public when it comes to global health issues like antimicrobial resistance. So we are seeing them as co-creators. They are co-producing antimicrobial resistance campaigns, designing short films, awareness posters, and even jingles. That way, beyond helping them change their behavior, possibly, they will also help in passing the information across to their neighbors and communities. And we're also looking at sustainability. We're talking about resources, we're talking about funding, which are barriers that can stop and that can hinder diaspora youth. So in terms of funding being a challenge, using community members can help in creating sustainability of global health interventions. And then when it comes to digital platforms and digital advocacy, I mentioned earlier that young people are not waiting to be brought to the table. They are literally creating the tables themselves, and they are doing this through social media. We had a question about the restrictions for workers here. There are young people that are using social media platforms to call out leaders, to hold them accountable. They also use these digital platforms to create interventions which benefits the UK and several other countries. There are people that might not always travel to the UK, but these interventions they are creating are helping to improve the health and well-being of those people. And organizations like the One Campaign, where young people are also using their energy, using their digital skills, using their talents to create movements that will help improve the health system of different countries. So these are just like different examples. And I love that I always say that diseases, infections, they don't need visas to travel. So whatever government is doing, whatever thing they are saying, we have to all work together to protect the health of everyone, no matter who they are, no matter where they are, even if they are women, no matter who they are, we have to support them. And this tells us in particular that youth engagement is very important, but it has to be supported, it has to be funded, and it also has to be trusted for it to work better. So thank you so much.